Board here, and we're going to hear from Dr. Jeremy Herschler today. He's an assistant professor in the Department of Behavioral Medicine and Psychiatry and is the Addiction Psychiatry Fellowship Program Director at WVU. He earned his medical degree from the Medical College of Ohio at Toledo, did a residency at University of Maryland, and an addiction fellowship training at the same facility. We've learned a lot about him, a lot about his experience in addiction psychiatry. We've learned a lot from his expertise in that area. We've also been learning a lot from him about positive psychiatry, and we're going to hear more about positive psychiatry and leverage in recovery, and kind of a combination of these two fields, it sounds like. Thank you, Dr. Herschler.
Thank you, Ernie. Appreciate it. So I'm going to talk about leverage, and my interest in leverage goes out of my training in addictions, but it applies to positive psychiatry. It applies to everyone, actually. And I'm interested to get a discussion going, perhaps, about some of these ideas and see what people think about the importance of leverage in treating patients. So I have no conflict of interest to disclose. So what is a lever? With a lever, you've got a beam and a fulcrum, and there's a load on one end of the fulcrum of the beam, and that effort applied to the other end. And it's easier to lift the load with a lever than it is to lift the load by itself. And so we're applying this kind of concept to psychology here in this practice. So back in 1997, Stuart Teagle, who was my therapy supervisor during my addictions fellowship, he said, you've got to find leverage. That leverage is so important in addictions recovery, and you got to find leverage. And I've been thinking about that ever since. So what I say is, in order for us to live better lives, we need the most clear thinking possible with thoughtfully aged ideas worked on slowly and carefully for years for a career. And so this is the concept that I've been working on since 1997, and let's see where we get with it. So here's an outline of what I'm going to talk about. So first I'm going to define the problem, or what is leverage going to address? And what it addresses is something I call languishing. And so is languishing a new psychiatric disorder, or is it a subtype of other disorders? How does languishing fit into mental health care? And so then the solution is creating leverage. And then I'm going to argue that leverage is nature's way. And so this is a natural phenomenon. And there's leverage models used in addictions recovery. So I'm going to go over where that applies in addictions. And then I'm going to talk about leveraging a flourishing life. So recovery from all mental health is really about ultimately flourishing, hopefully. And so we flourish in love, work, and health. And that's the goal of recovery from illness. And then I'm going to talk about reading the tension. So leverage creates tension, and you want to read the tension. And there can be constructive and destructive tension, too much tension, too little tension, and there can be a sweet spot where the tension is just right. And then we're going to go over a case example. And then I'm going to talk about future directions for leverage in addiction recovery and positive psychiatry. And then we'll make some conclusions about taking advantage of psychological tendencies, creating leverage, resolving incongruity and tension, and going beyond your limits in life and the patient's limits. So what is languishing? Now, languishing comes from a guy in positive psychology named Corey Keyes, who argued that the opposite of flourishing is really languishing. And he defined languishing in a different way than I'm going to define it. And I see it as almost a psychiatric disorder, something that should be in the DSM. And he was kind of arguing that it's more the opposite of flourishing. But so let's think this through. So what is languishing according to Merriam-Webster? Well, it's to continue for a long time without activity or progress in an unpleasant or unwanted situation. And the Gallup poll company in 2012 surveyed the world population, and they found that 75% of people are struggling or suffering. And so perhaps it can be a large percentage of people who actually languish to some degree. And so this is something that is important to many, many people. And so with languishing, people seem to become more and more passive rather than active in their approach to well-being. And some people become defeatist and demoralized by life experience and the limiting language and tools they have to succeed and thrive. So what are some possible criteria to describe languishing? So first of all, they may have a pervading sense of dissatisfaction with life or low quality of life. They may have an absence of clear, meaningful goals or ambition. They can have chronic feelings of boredom, low motivation or avolition, low expectations for oneself, low self-efficacy or the belief that they can accomplish things they want to accomplish, and feeling discouraged. And so what is happening is that they're kind of stuck in an unfavorable or unpleasant or unwanted situation with little or no progress or improvement and repeated failure to better their self or situation. And so they can be disempowered by a history of significant setbacks, have pervading feelings of helplessness and hopelessness, like you see with depression, to change or improve, and they're demoralized. And they're being avoidant and passive about problem solving. They have a lack of resources to make progress, little sense of autonomy, and they may be waiting for the pain to improve before they move forward with what's happening in their life. So there may even be some pathophysiologic findings associated with languishing. And so one thing that may happen is that the telomere length may shorten. And so telomeres are like the aglets on the end of shoelaces. They're on the DNA strands, and as DNA telomeres get shorter and shorter, it leads to more and more problems with the DNA and predicts kind of the end of someone's life if they get too short. And so this is kind of predicting longevity. And so I think the stress of languishing kind of affects telomeres. And then of course the stress is going to affect blood glucocorticoid levels. And so you could design a stress test to see if they have an abnormal response to stress. And then since cortisol varies throughout the day and the amount that's present in our system, it might be helpful to do a DHEA to cortisol ratio to see how those two hormones are affected by languishing. And so DHEA is the androgen precursor, which is going to be in a more confident person, while cortisol is more present in stress. And then also a shortened REM sleep latency. So we know that REM sleep latency gets shortened when people's well-being is being affected. And so these are all kind of pathophysiologic findings that could be associated with languishing. So where would we find languishing in the DSM? So is this an adjustment disorder with languishing or a persistent V code? So you think of V codes like highly problematic relationships or unemployment or underemployment. And so all these things can occur along with languishing. So when people are diagnosed with a V code, it doesn't speak to the longevity of how this person has persisted in this kind of unpleasant state of functioning. And so I'm arguing that languishing is something that we need to add to the DSM. And also maybe psychiatric, like addictions can be a languishing addiction. You know, this person just is stuck in this situation and there's just not improvement and nothing seems to empower them to feel like they can change. So what's the solution to languishing? Well, I say it's creating leverage. And leverage creates tension, and tension generates energy. So what you're doing is eliciting a response in the patient or evoking an individual's initiative in their own recovery and progress. And Ben Pekulski, who's a bodybuilder from Canada, says the only thing synonymous with growth is tension. And so with languishing, there's both a push and a pull to leverage. I'm sorry, with leverage, there's both a push and a pull to leverage. And so you can have a push from, say, someone's drives, that their libido and aggression can push them forward, and a pull maybe if someone's around people who are inspiring to them and makes them believe that they can accomplish things. That's more like a pull of leverage. And then you can have intrinsic and extrinsic leverage. And so some leverage, like intrinsic needs, are going to be intrinsic, whereas extrinsic forces like incentives or rewards, that's going to be a more extrinsic kind of a leverage measure. And so in the presence of leverage, we adapt, align, and self-organize coherently. And what we're doing is resolving the incongruity and tension that creates a new emerging structure. And so leverage helps things happen organically. It's a natural process. And so we can shape progress and recovery in a flourishing life with adjustments and leverage. And so you're going to see how that works. So why do I say leverage is nature's way? Well, let's go back to kind of what the outcomes are in people's lives. That is the interaction of genes and environment. And so we know a little bit about impacting genes, but the environment is really where you can impact the outcome of someone's life. And this is true for all living organisms, that genes and environment interact. And so it's nature's way. And so in designing a flourishing life, you have to consult with nature, align with it. And so when I work with addictions patients, I always ask them, what's your recovery environment like? Is this an environment that's going to have a positive influence on you, or is it more destructive? And so you don't want to be passive about your environment. You want to make it great and work diligently to understand the nature of the environment, and then make the conditions great to optimize your person originating environment interaction. So how does environment influence genetics? Well, it happens through epigenetics. And this slide is really kind of more about pathology. So you've got pathogens and toxins and that sort of thing, but it goes the other way too. So the environment can be a positive influence through epigenetics on genetics. And what happens is that you're turning on promoters or turning off promoters of genes, or one gene is impacting another gene. And so that's all the epigenetics of how the environment impacts what happens with people. So what are the leverage models currently used in addictions? So how about motivational interviewing? So the core element of motivational interviewing is raising a discrepancy between where the patient is in their current life and where they'd like to be. And so you want to raise that discrepancy, and that's what motivates somebody to change. When they see, hey, I can live a better life, there's room for improvement. And that creates leverage. It impels the person to take action and to do something different. And so that treatment is solely based on raising that discrepancy. And there's techniques that are used along with motivational interviewing, but that's the core element of it. And then contingency management is about using incentives. So you reward the patient for having a negative drug screen or for attending the appointment. And so you're actually giving them a monetary reward of some type. And so that's creating leverage. You're impelling the patient to follow through with what you're hoping they'll do by creating a leverage through incentives. And then seeing is believing is also a kind of leverage that patients experience. And so in AA and NA, they have sponsors, and sponsors are people who are doing well. They've been successful in their recovery, and it's inspiring the patients to meet these people and realize, hey, this can be done. And they hear stories in speaker meetings where the story sounds a lot like theirs, but the person's been sober for years. So, how is that possible? It makes it believable to them. And so it's really down to emulating role models and to see what's possible in another well put together person. And so that seeing someone successful creates leverage. And then you have social group reconstruction as part of addictions treatment. And so we try to create a social environment that's going to be healthy for the individual. So that means getting phone numbers out of their telephone of people who trigger substance use, and not having an environment at home where people are using, and trying to live in a area of where they're living where there's not a lot of people tempting them to use substances. And so social group reconstruction is really about harnessing the effects of a social network. And so that can be positive as well as, for thriving, as well as for addictions recovery. And you can see how that creates leverage on somebody. And then hitting rock bottom. So they talk about consequences. Traditionally in addictions, that was really the thinking, that somebody had to hit rock bottom and really be in a miserable place to say, hey, this is terrible, I've got to do something now. And so that creates leverage too. And then some people have high bottoms So maybe the consequences aren't so severe, but for that person, it's enough. And so that high bottom can create a leverage in the individual. And then asking why a patient is here, why do they want help or to improve? And that why can create leverage. So maybe they want their children back, they lost custody of their kids, or they're tired of the lifestyle, or they lost their job and they want to get a job back so they can support their family. So whatever their why is, that creates leverage. And then if you think of addictions interventions, so I don't know if you've seen those, there's actually a show where they show addictions interventions. But basically what you're doing in that situation is gathering all of the important people in someone with a substance use disorder's life to put social pressure on the person, to impel them to get into treatment and start working on recovery. And so you can have pressure from family, friends, employer, anybody who's connected with the individual, who cares about them and would want to make a change. And that social tension is leverage. And then competition with successful group members. So in the Coke Clinic, we use a group model, and some patients do beautifully. And patients may have like a competitive feeling, I can compete with this person, I can do better. And so that you get that kind of competitiveness of success that impels them to work hard on the recovery together. So that's another form of leverage. So let's look at the data about these forms of leverage in addiction. So how about motivational interviewing for smoking cessation? Well, here's a review of 28 studies, and they found that single session treatments increase the likelihood of quitting over multiple sessions, but both regimens produce positive outcomes. And so motivational interviewing is effective. So raising a discrepancy between where life is now and where they want it to be helps to impel people to change. And so that leverage has some evidence to it. And then what about contingency management? So here's a review from just last year of contingency management for the treatment of methamphetamine use disorder. And here 20 of 21 studies reported abstinence outcomes that were improved by contingency management. And even 7 of 9 of those studies showed improvements in high-risk sexual behavior as well. So rewarding patients, using incentives to make a change in their substance use behavior and other addictive behaviors is a powerful way to impel somebody to change. So leverage is a key here. So how about leveraging flourishing? And so I talk about flourishing being flourishing love, work, and health. And so how do we leverage that in someone's life? What about their informational diet? So what do people expose themselves to and the information that they surround themselves with in their life? And what's the quality of that diet? And so you can have a positive diet that creates leverage to improve, and it can be a destructive diet. And then you can have leverage from their personal values and mission or their purpose. That purpose creates leverage to move in a positive direction. And then investing for the future. So if somebody invests in exercise equipment or their education or any kind of investment for future success, that investment is creating leverage for the person. And then compelling challenges. So, if somebody says, "Oh, this is going to be a fun challenge. I gotta see what I can do with this." That creates leverage. And then even working with the identity. So asserting a strong and distinctive identity and evolving your identity over the years, that creating that aspirational identity can create leverage. And then even the effect of, so we're talking about social group reconstruction. So the appeal of a person's mates or friends they surround themselves with, that can create leverage. And then also the way someone advertises themselves. So through attire, through their expressed ambition, through the formality of their language. So all those things impact them in a leverage kind of sense to see how much they flourish in life. So just for example, if you had a patient who's wearing a shirt in addictions recovery and it's got a marijuana leaf on it, that's going to have a different impact on him and the group that he's attending than if his attire is, more appropriate, or they've got a bar shirt on or something like that. So you can think about how attire can impact people. And so what you think affects what you do, but what you do affects what you think too. And so what I'm saying is that the way one looks at work or in their life is a visual promise of the quality of work that you can expect them to deliver. And so what I think is a physician with a regal bearing promises by his presence or her presence to deliver great health care. And so the way you look is a visual promise. It's a metaphor. It's a visible symbol. It's a signal. And it's a promise to other people, but also to yourself. And so I believe in the relevance of clothes, the psychology of clothes. And then also you can do the same thing with posture. So how you hold yourself and the posture that you present yourself with, that can leverage the way you behave. And then in scouting, they talk about someone having a good face. So like a baseball scout who's trying to recruit great baseball players, they look for that confident look in the athlete. They have a good face. And so, that you can see it even in someone's facial expression, the leverage they place on themselves. And then also walking, the way a person walks, does it appear powerful and happy and relaxed? So, the walking can create leverage, or the conviction and the emotion tone of someone's voice, or radiating the energy and emotions of what someone's aiming for in life. And so what I'm arguing is that there's leverage produced by the need for self-concept consistency. And so if you push yourself through the way you're demonstrating your self-concept, it impels you, it creates leverage to improve in your life. So how else can we leverage success in life? Well, previous experiences of real success in your own life or that of another who is successful, who is helping you, can evoke new success. And then inspiring stories of others' triumphs against all odds can leverage grit and determination in someone. And then having rewards, you use incentives to reward successful behavior. So like a stylish watch or a vacation or an outfit for reaching your aim, that can incentivize success. And then also the drama in our lives can impact us in a striking way. And so the placebo effect is a good example of how drama impacts people's health. And so it's the drama of healthcare that creates expectancy and healing in people who respond to placebos. And you can also see drama in a coach's pregame speech, that a coach's speech can leverage victory in a game. So I'm going to show you a movie clip of drama being applied to a sports team. Let me click on this, see if this works. I hope you can hear it okay.
What's the deal with Matt?
Upper leg contusion. I think he's done for the night.
What if he plays?
I don't understand.
Jeremy, we're not seeing it, so we're hearing it. We're not seeing it.
Well, no, but it will be very painful for
Maybe
him.
hearing it'll be enough.
Very much.
This is unbelievable. You guys are playing like this is some throwaway game up in Rochester. Who we playing, Rammer?
Sweden.
Yeah, you're damn right, Sweden. What the hell's wrong with you? Put your gear on. I said put your gear on.
The doc told me I can't
Yeah,
play.
I know. You got a bad bruise. You know what? Put your street clothes on, because I got no time for quitters.
Come on, Herb. Nobody's quitting here.
You worry about your own game. Only there to keep you busy. Bruise on the leg is a hell of a long way from the heart.
What'd you call me?
You heard me.
You want me to play, huh? Is that what you want? I want you to be a hockey player. You only play on one leg, huh? I'll play on one leg.
That'll get them going.
Get up.
Oh, yeah.
That makes you happy.
I'll clean up.
I am a hockey player.
Whoops. All right, did you guys hear that okay? Dan, did they hear that okay?
It was a little, I think we got the spirit of it, yes.
Oh, okay, so the point is that drama can have a pretty big impact. So that's from the movie Miracle about the U.S. hockey team beating the Russian hockey team back in the 1980s, and just an incredible victory over a invincible Russian hockey team. And so depicting how the drama impacted the success of that hockey team. All right, so what about the placebo effect? So placebos have a powerful impact on depressed patients, and the rate of relapse for people who are successfully treated with placebo is only 25%, whereas for various antidepressants, it ranges from 42 to 57%. And then the response rates for placebo in antidepressant trials ranges from 30 to 40%. And in milder forms of depression with shorter episodes, the response rate is close to 50%. And that's really indistinguishable from the rate with antidepressants. So placebos are a powerful treatment that's really about the drama of healthcare and how all the things that happen in healthcare impact somebody's health that has nothing to do with the medication itself. So what about leverage from belief? So two groups of women who were housekeepers in a hotel were compared, and one group was told that the physical work that they're doing as a housekeeper was good exercise and a healthy exercise for them. And the other group were not told anything about the importance of exercise. And they measured their health status after 4 weeks. And the group of housekeepers who were told they were doing exercise improved in weight loss and lower blood pressure. So there were improvements in their health status, whereas the other group didn't have any impact on their health status. And so what you believe has a powerful impact. It creates leverage on your health. And so what would you be doing if you really believed in yourself deeply, if there was absolutely no reason to question or doubt yourself? And so belief is such an important way of creating leverage. And then what about leverage from metaphors? So do metaphors predicate our future? So if you were to give a patient in psychotherapy at the beginning of their therapy a little puzzle to solve, would that impel them to solve the puzzles of psychotherapy through priming and metaphor? Or Milton Erickson, who is a famous hypnotherapist, he's no longer living, he used to have patients climb Squaw Peak in Arizona before they would see him. And he would argue that climbing a mountain impels the patients to solve challenges in their life, climbing the mountains and their challenges. And so maybe that creates priming and metaphor and leverage on the patient. And so is a calling toward a particular career or way of life a metaphor? And then what about drive? So Freud believed that we have instinctual drives for libido and aggression that can be helpfully sublimated or channeled into constructive things. And so it's that pushing yourself into dominance through aggression and being warm to people through the libido. And so those drives impel us to do things, and that there's a leverage to that. And then we also have a drive for homeostasis. So there's a leverage to create balance in our lives. And that's always present, to try to create balance. And then we have leverage from needs. So we have needs for confidence, to be autonomous, competent, belong, achieve, have power, to have meaning, health, self-esteem, beauty. So these are all psychological needs that are present that create leverage on people and affect their flourishing. And then emotions are kind of the way that leverage can work in some cases. And so emotions arise from our appraisal of events. And so, for example, if you get feedback about something that you're doing, that feedback creates an emotional reaction, and that's leverage for the person to either improve things or, depending on what the nature of the feedback is. And then people get emotional reactions to people believing in them. If somebody believes in you and thinks you're spectacular, that affects your emotions and creates leverage on how you perform. And then we also have emotions that arise from obligations. So if you feel obligated to perform something or act in a certain way, that there's leverage there impelling you to act in that way. And it's an emotion that is arising that creates that. And then you can have leverage from setting an agenda. So things to-do lists, help counter procrastination. And New Year's resolutions are a wellness tradition that we have in our country that creates leverage by setting an agenda. And so I tell patients, a lot of patients in addictions recovery talk about being bored. And so I say, it's not entertainment that is the answer to boredom, it's setting goals. When you have a goal to work on, that always impels you to do things and to have things to do with your day as you work toward those goals. And so hunger creates leverage. And then we have leverage from visualization. So Jeff Bezos from Amazon, the CEO of Amazon, says, be stubborn about your vision and flexible with the details about how to get there. And live your life out of a vision, not a circumstance. And David Cook says, feel it, see it, feel it, trust it, and then produce it. And so what happens with visualization is you get a perceptual readiness. And so you become sensitive to visualization relevant things in your life, in your environment, opportunities. And so you seize on those opportunities because the visualization made you ready to take them. And so you get a feeling in the body of it and then enact it with a visualization. And then going back to Milton Erickson, who was a famous hypnotist, he used indirect suggestion as a way to leverage people to change. And so some examples of indirect suggestion, you can use binds. And a time bind is a good example of that. So you may say to someone, don't solve that problem until you lie down in bed tonight. So it implies that they're not going to solve it now, they're going to solve it later, and kind of forcing them through just language to solve the problem later. Or you might say, I wonder if things will improve quickly or slowly. So again, that's a time bind. The things you're implying that things will improve, but they wonder, will it happen quickly or slowly? And so you give them the option to improve either way. Or you can ask what part of your body begins to feel most comfortable. And so you're kind of forcing the patient to be comfortable in one way by asking what part of the body. Will you be ready to quit smoking this week or the next? Or would you like to become more calm in your room, or would you rather become more calm in the day room? So you can use this kind of forced choicing with an escalating patient in the, on an inpatient unit, that you can suggest that they calm down either in their room or in the day room, and it gives them a choice. But the end result is that they calm down one way or the other. And then he used implied directives. So for example, you could say, you might be surprised how quickly things turn around with this medication. So you're saying they might be surprised, they may not be surprised, but that things are going to turn around with the medication is what you're implying. Or you could say, it will be interesting to see how you improve. And so the patient will think, well, no, it won't be interesting, but it's still implying that they will improve. And so that's kind of the beautiful language that Milton Erickson used. And he used that in hypnosis. And the key to this is that it kind of bypasses resistance by using language in an indirect way. And then you can have leverage through music. So one of our best allies of our motivation is music. And music can help push someone through that wall. And so I'm not going to play this because I guess it's not giving you very good quality. But this is Thunderstruck by AC/DC. I don't know if you guys have ever heard that song before. I recommend you listen to it. It's a very motivating song. It's a powerful rock song by AC/DC. And then you may even have leverage created by pheromones. So with bees, the queen of the hive controls everything through its scent. And so we have instinctual reactions to scents. And so can you impel somebody to improve in their life through a scent? We know that the scent of drugs and paraphernalia related to drug use can incentivize use of drugs, can trigger drug use. So can we use positive scents? Others is a scent of confidence, or another scent, can that impact somebody in a positive way? And then we have leverage created by culture. So there are certain places in the world where wonderful things happen over and over again. And so what state of mind and what energy and attitude is evoked in us by such places? And so the self adapts in adaptation to the cultural environment, and the culture creates leverage. And so the culture has a collective ego, and we can impact that ego because culture is an ongoing process. And so what I recommend is an aspirational spirit in the culture. and that we should have a solid investment in culture. And so in healthcare, maybe the ideal culture is the careful consideration of the welfare of the patient and having that as a pervasive kind of priority throughout the organization. And then you can also have leverage created by adversity. So adversity gives people the opportunity to become more empowered, that it's an opportunity to become strong. And so compelling challenges are really the leverage created by adversity. And when I worked in Baltimore, I had a patient who said that he liked winter because it gives you something to work against. Summer's too easy. And so he had a great attitude about, tackling challenges. And so it's as natural as Darwin's evolution. It's the flourishing of the fit. And so John Noseworthy, who was the prior president and CEO of the Mayo Clinic, said that he was able to attract people to Rochester, Minnesota, from some of the big cities that had the most excellent medical care, like New York City or San Francisco or Boston or Baltimore, because there's no tension in Rochester. And so patients, the clinicians can focus on fighting disease rather than one another. And then there can be leverage created by experiences. So I argue that there's 4 main stances toward experience. You have embeddedness or living in it, non-judging detachment or being the witness, reflectiveness or making sense of the experience, what does it represent, and utilization or being response ready to use whatever happens in life to mitigate problems and construct a flourishing life. And so we have to transition flexibly between these different stances. And so we can have enriching positive experiences or challenging negative experiences and really utilize our experiences in a leverage kind of sense to enhance our psychological growth. All right, so let's talk about reading the tension. So you can have both constructive and destructive tension. So does the leverage present promote growth or ruining? And so, for example, people can have guilt that makes them want to punish themselves. And so that's a destructive tension. Or a social network can be destructive if the network is negative and disempowering. And then triggers can be destructive, if they evoke, repeating behaviors that are unhealthy. And then you can have too much tension. So if someone has too much tension, the intensity can overwhelm them and demoralize them. And so you don't want patients get a defeatist attitude because the tension is too much. And so we can spot problems by noticing, exploring the tension, and actually read the tension or the nature of the current forces that's impacting an individual or a patient. And then too little tension, there can be apathy and languishing and avolition and boredom. And so too little tension fails to challenge the psychological apparatus needed for growth. And so what I argue is that there's a sweet spot, and I call this progressive overload, kind of like what you do in physical fitness. And so it's not too much tension and it's not too little, it's just right. So if you think of a tennis racket, they have that sweet spot where you hit the ball best. And so you want to achieve a tension intensity where growth best occurs. And you have to oscillate between the tension and recovery or unwinding to get a healthy rhythm. All right. So I'm going to minimize this so I can read the. So here's a case example. How much time do we have? All right. So a 29-year-old male with a history of opiate use disorder, stimulant, methamphetamine use disorder, and unspecified depressive disorder, who was treated for 2 years with Suboxone. He's very intelligent, enjoys reading the Harvard Business Review, watching TED Talks on YouTube, and attending court hearings at the local district court. He has had a long-term relationship with a beautiful young lady who moved across the country to be away from him because of his persistent languishing state of little to no growth, of not going anywhere. He remained fixated on this woman. He never worked other than some infrequent music gigs. Eventually, after years of treatment in which he was rather stable psychiatrically, he relapsed to methamphetamine and alcohol use. He was sent to inpatient rehab, and following his discharge, relapsed again, and then refused to go back to the rehab and was administratively detoxed off Suboxone. His addictions therapist saw him as perhaps entitled and resistant to change. He described feelings of guilt and thought that maybe he was sabotaging himself as a way of punishing himself for past misdeeds. So here's my questions. First, how can we create leverage for recovery in a flourishing life? And is the current tension from leverage destructive or already too much and undermining his recovery and growth? So let me get back to the... Does anybody have any thoughts about this case?
If anyone wants to just unmute, they can comment.
Well, I'll help you out here. So first of all, he says that he feels guilty and he thinks he's sabotaging himself as a way for punishing himself. And so that's an example of a destructive tension created by leverage. And then his ambitions are so big. You know, he attends court hearings in the local court like he wants to be a lawyer, or he reads Harvard Business Review like he wants to be a CEO of a company. And so maybe his dreams and the things that his informational diet is so extreme that it's just too much and, you know, disempowers him. And so how can we create leverage for recovery? Well, so we need to think about things in addictions, like what's his social group? And, does he have a discrepancy between where his life is now and where he wants to be? You know, he's still interested in that woman that he liked. You know, how can he get himself to a place where she would regain interest in him? And so there's so much that you can do with leverage to impel someone to flourish. And so all those kind of elements that we talked about are ways that this patient may be impacted by leverage, but not overdo it and get to that sweet spot, if you follow what I'm saying. Any thoughts about this?
Jeremy, this is Dr. Miller, Mark Miller. Do you think this patient has excessive narcissistic traits that are getting in the way of him doing his best bidding for himself?
That could be. So maybe these kind of aligning with such extreme success, you know, with the court hearings and the Harvard Business Review, and, you know, that even his therapist saw him as entitled, you know, that suggests kind of a narcissism that's interfering with his improvement. And, you know, with narcissistic patients, they often, you know, they have to help themselves unless they can become dependent on you and allow you to help them. And so maybe part of him is, you know, that he has to help himself. He can't really accept help from someone else. Any other thoughts? All right, I'm gonna move forward. So what about future directions? So I think what we want to do is transform the understanding of leverage in addictions and mental health care through basic and clinical research. And maybe it's even possible to get this down to specific neural circuits. Or maybe we should have technological leverage solutions and computational models of the leverage in someone's life, and even integrate it into the electronic health record. And maybe we should leverage integration into lifestyle optimization, or design leveraging environments. You know, that maybe we should think about what our environment impact is on us and how can we leverage a better environment. And so I think we want to be able to read the tension as a diagnostic tool. And it's kind of like taking the leverage temperature. You know, is it too hot? Is it too much leverage? Or is it too cool, not enough leverage? And you want to adjust the shape of the leverage and the temperature. And so we want to explore everything impacted in the person by the sum of the leverage and tension over the long term. And then hopefully we can create therapeutic leverage patterns or multimodal integration directed at the aims that someone has in their life, and have these aim targeting patterns personalized and comprehensive and tailored to the needs of the individual. And of course, that we need it to be evidence-based. So I think there's a lot of potential for this leverage model in both addictions recovery, I think psychiatric recovery, and ultimately flourishing in life. So this is the art of wooing nature. So what are my conclusions? Let's learn how to read the present tension situation, the nature of the current forces, and examine it in depth down to the smallest detail in order to adjust the shape until it's optimized. And so we want to take advantage of psychological tendencies and not sleepwalk through life. And so what you're doing is resolving incongruity and the richness of tension to get to a new point. And so what we're hoping to do is advance and engineer the leverage to impel people to bridge the gap between what's happening and what's possible in their lives and live long, prosperous, and healthy lives. And so the last thing I want to say is that the science of leverage and its stories of successful recovery could change public perceptions about recovery and human potential. So part of the reason I think there's so much stigma in addictions and other aspects of psychiatry is because people don't believe in the treatment enough that they think people can really be successful and live good lives and contribute to the world. And so maybe by enhancing our understanding of leverage and how to leverage success in a person's life, even if they are coming from a place of a pretty serious illness, what is the potential of leverage in someone's life? So here's my references. Any thoughts, folks? Do you guys agree that languishing should be a psychiatric disorder? Oh, here got some stuff in the chat. Having a preferred demeanor and aesthetic is incredibly significant to self-concept. Hearing but a little muffled, okay. No thoughts about this concept? I think it's super important in addictions recovery. When Stuart Teagle taught me that in 1997, I didn't realize I was going to think about it for the rest of my career. But I think whenever I encounter a patient with an addictive disorder, I'm always thinking, what is the leverage here and how can we optimize the leverage situation for the health of the individual?
It looks like Walter was getting ready to ask a question there. You want to go ahead and unmute Walter?
Yeah, I think the leverage idea is really wonderful in a way because there's so many different ways you can approach leverage, and so it's really, you can find a person's area where they're the most susceptible or most approachable, and so you can sort of look for what leverages them in a positive way, and it can be about as adaptive as the human being is, which is kind of nice. It's in a sense, it's about as flexible approach as you can come up with. So I like that.
Yeah, I think it's interesting, and it does make a big difference in what patients ultimately do. And when you think about instances when patients are kind of stuck, I would definitely be thinking about what is the leverage here, and is there something we can do to shift this leverage to impact the patient changing?
Right. I think we seriously need some leverage T-shirts, Your lawn that looks like this, your lawn looks a little bit more like